Today, we are going to talk about Osteochondritis Dissecans, or OCD, across veterinary species. Clinically important OCD is seen mainly in dogs and horses, while osteochondrosis is also a developmental cause of leg weakness in pigs. OCD begins as osteochondrosis, a focal failure of endochondral ossification. Normally, growth cartilage is replaced by subchondral bone. When blood supply to a focal area of developing cartilage fails, the cartilage remains thick and weak. Joint loading can then create a crack. Once a flap separates from the underlying bone and opens into the joint, the lesion is called OCD. The flap irritates the synovium, producing effusion, pain, and secondary osteoarthritis. In dogs, signs are usually recognized between 4 and 8 months of age, especially in rapidly growing large and giant breed males. The classic site is the caudal humeral head of the shoulder, although the elbow, stifle, and hock may also be affected. The dog usually develops progressive lameness that improves with rest and worsens after exercise, with pain most obvious when the joint is extended. Radiographs may show flattening or a concave radiolucent defect in the caudal humeral head with surrounding subchondral sclerosis. A mineralized flap may be visible, but a purely cartilaginous flap can be missed. CT defines the defect more clearly, while arthroscopy confirms the lesion and allows treatment. A small, stable canine lesion may initially be managed with restricted activity and weight control, but persistent OCD is usually treated arthroscopically. The flap is removed and abnormal cartilage and bone are debrided to a stable margin. Bleeding from exposed bone allows fibrocartilage to fill the defect, although it is less durable than normal hyaline cartilage. NSAIDs inhibit cyclooxygenase and reduce inflammatory prostaglandins, decreasing pain and synovitis, but they do not reattach the flap. Prevention in dogs means controlling growth rather than maximizing it. Large breed puppies should receive a complete diet formulated for large breed growth and measured portions that maintain a lean body condition. Calcium tablets, bone meal, dairy products, phosphorus, or vitamin D should not be added to an already balanced diet. Young puppies absorb calcium less selectively than adults, so excess calcium can disrupt skeletal remodeling. The calcium to phosphorus ratio should remain near approximately 1.2 to 1.4 to 1. In horses, lesions develop during early growth, although signs may not appear until training begins. Foals may show stiffness or joint swelling, while older horses may present with performance loss or exercise-associated lameness. The major sites are the tarsocrural joint of the hock and the femoropatellar joint of the stifle. Hock OCD often produces bog spavin, meaning visible joint distension that may be minimally painful. Stifle OCD more often causes effusion, reduced hind limb engagement, shortened stride, and lameness. Standardbreds and some warm blood lines have increased genetic risk. Equine radiographs may reveal an osteochondral fragment, flattening of a trochlear ridge, a subchondral defect, sclerosis, or lysis. Both limbs should often be imaged because lesions may be bilateral. Ultrasonography can identify effusion and accessible cartilage defects, but arthroscopy may be needed when the flap is not mineralized. Clinically important fragments are usually removed arthroscopically, followed by lavage, restricted exercise, and gradual rehabilitation. NSAIDs reduce postoperative pain through cyclooxygenase inhibition, but corticosteroids do not correct the developmental lesion. Equine prevention also depends on steady growth. High-starch meals that cause rapid weight gain should be reduced rather than counteracted with extra supplements. The ration should keep calcium and phosphorus balanced and provide adequate copper and zinc. Copper supports collagen cross-linking, but excess zinc can reduce copper absorption. Normal turnout supports skeletal development, but repetitive forced exercise should be delayed until the joints can tolerate it. In pigs, lesions can begin before 6 weeks of age, but clinical leg weakness is more often recognized after 4 to 8 months, especially in fast-growing replacement gilts and boars. The elbow, stifle, hock, vertebral joints, and growth plates are commonly involved. Affected pigs may become stiff, Take shortened strides, shift weight between limbs, walk on flexed carpi, resist standing, or become unable to rise. Radiographs or necropsy may show irregular growth plates, cartilage clefts and flaps, exposed subchondral bone, and osteophytes. Blood work is usually normal, while fever or inflammatory changes should redirect attention toward infectious arthritis. There is no practical medication or routine surgery that corrects porcine osteochondrosis in commercial production. Analgesics may improve comfort temporarily but do not restore abnormal growth cartilage, and severely affected breeding animals are commonly removed from the herd. Prevention depends on genetics, controlled growth, non-slip flooring, and trauma reduction rather than one supplement. Replacement pigs should receive a complete ration without excessive mineral addition and be selected for sound legs rather than only rapid growth and heavy muscling. The major takeaway is that OCD begins with vascular failure and abnormal cartilage to bone conversion during growth. Mechanical loading then creates the flap that causes synovitis and secondary osteoarthritis. NSAIDs control pain and inflammation, but they do not repair the lesion. Early diagnosis, arthroscopic removal of unstable tissue in dogs and horses, controlled growth, balanced nutrition, and responsible breeding provide the best chance of preserving joint function. If you have topics you would like us to make content on next, or would like to donate to our video or game development, reach out to @doggersgame or dogtoursgame@gmail.com.